NEA Big Read is a program of the National Endowment for the Arts in partnership with Arts Midwest. Local sponsorship is provided by the Muskogee County Friends of Libraries.
Hello, everyone. I am Dr. Maleta Whitfield-Parker. I'm a clinical pharmacist here in the Columbus, Georgia area, and I would love to talk with you about my wonderful profession and offer some safety tips. Pharmacists play an intricate role in the medical profession and with the public health. We work alongside with your medical provider to make sure your medications are optimized, dose and selection are appropriate. Our goals are to provide you with medication information and to identify medication related issues and drug interaction. Now, there are times when you may see multiple providers. That's fine. We will check your medication profile for duplicating agent that can have a negative impact on your health. This is why we urge everyone to keep their medication at one location. By doing this, there's less risk for one interacting with the other, being on same similar medication, and it just makes our job easier to catch these issues. Now, at times you may be on multiple medications. That's fine. But as you know, medication can be dangerous if it's not taken properly or stored properly. And one option of storing it properly is a medication cabinet. Yes, a medication cabinet offers a great option for storing your medicine properly. But make sure it's out of the reach of children and vulnerable teens and pets. Also make sure that this medication cabinet is in a dry, cool location, like a dresser. It could be on a shelf, closet. You don't want it in the kitchen around hot appliances or in the bathroom where humidity can impact the ingredients and make your medicine not work well. Also, it's a good idea to have an updated list in there, to have your medication with childproof caps if possible, and check periodically for expiration dates. So if there's any medicine that's expired, you no longer use it, take it to a program that offers a medication take back, where they will take your expired medication and dispose of it properly. Now, outside of prescribed medication, what are some other medicines you can keep in this medication cabinet? Now, these are just some suggestions from me, but always check with your medical providers to make sure it's appropriate. One agents are antihistamines like Benadryl, Claritin, Zyrtec. They are great for allergies, hives, and allergic reaction if you're able to use them. Now, if you have asthma, if you have certain thyroid disorders, and if you also have glaucoma, you want to check with your doctor. Also, antibacterial creams and ointments are good for cuts, abrasion, and insect bite. You can also keep pain relievers like Tylenol, naproxen, ibuprofen, or aspirin. Those are good for things like pain, fever, and certain cardiovascular prevention. Now, if you have blood disorders and you're on blood thinners, kidney disease, liver disease, you just want to check with your medical provider or your pharmacist to make sure it's appropriate for you. Antacids like Tums, Rolaids, Maleta are good for that occasional heartburn or for like acid reflux. But once again, if you have renal disease, that's a no-no. Also, if you have colds, cough and cold products are good with or without decongestants. And if you have high blood pressure, you want to only use the one specific for those with high blood pressure. Intranasal sprays are good, like Flonase. For nasal congestion that you get after allergies and cold, they're a great option for those who have high blood pressure. Now, I have gotten questions as far as whether or not we should keep activated charcoals or Emicat in your medication cabinet. I wouldn't recommend that you keep these on hand. It's rarely recommended. So if you suspect an overdose or poisoning, immediately call 911 or the Poison Control Center at 1-800-222-1222. Once again, if you suspect an overdose or poisoning, immediately call 911 and the Poison Control at 1-800-222-1222. I thank you for your time and attention. Have a wonderful day.